Welcome. Thank you for attending What Now? Meet the Authors. The What Now book is a guide for burn survivors and their loved ones in their journey from leaving the hospital and going back home. Today we have a variety of different authors who have contributed or are passionate about some of the topics that we'll be discussing today, and we're really excited to have everyone with us. Before we get started, actually, James Bosch, I was hoping that maybe you can share with us for a second about how the What Now book got started and why we are doing today's webinar.
But I'll just jump in and say that the What Now booklet was the brainchild of Lisa Powell, Ebby, who I see is her name on the participant list. So she's in here today, which is really exciting. So Ebby was the executive director of the Lisa Ann Rouge Burn Foundation back in the day when I was working there with her. And, you know, we were starting to go into the hospitals and help people more and more with that discharge process, transitioning from the hospital back to their life. And there was all these questions, and the questions we, kept coming up is like, what now? Because it's such a scary time often to leave the safety of the burn center to go home and have to deal with all the things you have to deal with on your own once you don't have this huge staff of people looking after you 24 hours a day. And so, this idea was to create a pretty comprehensive booklet, bringing together all kinds of people in the burn world, this powerhouse that we have today, but other people contributed too, to have a really comprehensive guide to going home. And it's evolved over time. We did a major rehaul of it, led by Sadie Wilcox and myself several years ago. And then there's some new stuff that Daniel's going to talk about as well. So anyways, we're really excited to present this tool for you today. And I'll turn it back to you, Daniel, to get us going.
Thanks, James. Thank you for everyone for attending. First, we'll get started by the journey of just going back home after discharge. And we will have Jill Sproul, who's had a long career as a nurse manager and as a burn nurse, share what she has experienced from burn survivors leaving the hospital. Jill, can you just start off by telling us a little about who you are and then the going home process?
Well, my name is Jill Sproul, and actually it's great to see so many familiar faces. I am a burn nurse and a burn survivor. Was burned at age 7, and went to become a nurse and worked in the burn center for 27 years, but was really involved in the burn center for 28 of my 30-year nursing career. So, seeing thousands and thousands of burn patients go through the burn center. On discharge is always a huge milestone. People can't wait for the date. And then the date gets there, and then people often are like, oh my gosh, I'm not ready to go home. So I think it's a really normal feeling to anticipate that date and be so excited about it, to then be very afraid, fearful. Am I going to be able to handle it? And so again, fear, excitement, and a sense of relief. The burn center also, depending, a lot of our patients, many of you might have spent a long time in the burn center, and we get very, people get very comfortable with the burn nurses and the physicians, and the OTs and the PTs, and everyone on the burn team, and it becomes a safe place. So it can be very scary going home. So I always see discharge as a hopeful time, that it's going to be, time for people to get back into their life. But then going home, and as James said, that a lot of times people are like, okay, now what? And it's really adjusting to their new life as a burn survivor, and that can be a really challenging time. So I can't tell you how many times I saw so much excitement on the day of discharge to, weeks and months after, people coming back to clinic and not having that same level of excitement. Because, going home, just having to learn how to do a lot of physical things again, how to eat, dress yourself, go to the bathroom, take a shower, and just the walk out to the car can seem long. So all these mixed emotions are really very normal I guess that's the most important thing to say. And at World Burn during open mic, we often hear how when people talk about their injury, how lonely and isolated people feel when they get home. And that's a really normal feeling. And so I think anything to prepare for that time, which is asking the burn team a million questions, reaching out to all the resources, all the burn foundations. There's so much stuff online, online chats, online support groups. Really, you know, knowledge is powerful, and as much as you can be prepared. I think also it's helpful to really kind of pick the burn team's minds as far as, you know, what to expect. And then also be aware that just the physical rehab is going to be difficult and challenging as far as becoming easily fatigued, learning to deal with your pressure garments, your itching, temperature regulation. We all know the list. I think one area that sometimes over the years I've had burn survivors say, gosh, when I left the burn center, my scars were flat, and now 6 months to a year later, my scars are getting worse, not better. So again, just the scar maturation process is something sometimes people aren't prepared for. A number of reconstructive surgeries, again, is something that people sometimes aren't prepared for. And then I think also anything we could do as a burn community or as burn survivors talking to other burn survivors, that sometimes, you know, there's no book that goes along with friends and family members. So often they just put their foot in their mouth trying to be helpful, and it can be hurtful, and it can make you angry and want to lash out. So maybe that's the next book. The next What Now book would be how to better prepare friends and family members, because I've had spouses, parents, children of adult burn survivors. I just don't know what to say. I feel like everything I do is wrong. So again, trying to get the family prepared also. Maybe I'll pause there because it looks like James wants to say something.
No, I'm agreeing with everything you said. And I was, when you were talking about preparing the family members, you know, as working as a foundation and all of us working with survivors, we look at the whole family, the survivor and everyone else that's affected by the burn as also experiencing a trauma. So we consider everyone a survivor. And I think that there is a section in the booklet that Cindy's going to cover on for the families. And, but I think also like there are programs like that Pam will cover at the end about like the Phoenix Society, some resources that prepare everybody for going out in public, for the emotions, for how to talk about their burn. So I think it's a really great point that when we're dealing with the what now is that you have the survivor, but you have these family or friends that are going to be taking care of this person that are like, I'm going to be a nurse and and I don't know what now for me, you know, and the changes in everybody's life after a burn injury. So that's what I was really connecting with. Yeah, for sure.
I think I'll make one last point and then turn it back over to our facilitators. I think just the amount of how overwhelming every aspect of going home can be, from how do you get your pressure garments on? Am I doing it right? Am I creating more wounds by trying to yank these on and off? Am I taking my medications correctly? Why am I still having pain? And so I think my message to everyone going through this, please stay connected to your burn team. We are used to getting those calls in the middle of the night from a frustrated spouse or family member. We're open 24/7. And we are really here to guide you, because we never want people to feel that they don't have a lifeline to call. And it's a new experience, and we expect there to be questions. And then continue to be connected with your outpatient therapy. I know oftentimes people don't live close to the burn center, and so they have their outpatient therapy further distance. But it's important to stay connected to both. And then all of the resources out there. I have to say, just for me, it breaks my heart to see a struggling survivor when they go home, when we have so much resources and we are at that, especially with all the technology today, we are at people's fingertips.
Great.
Thank you.
Thank you so much, Jill, for your insight. I think that, you know, it's the What Now brochure was really created for burn survivors to prepare themselves for going home. So I think Jill touched upon quite a few different topics that a newly burn injured person might not even know the answers to, or might not know what the next steps are. So thank you, Jill, for kind of touching upon some of those immediate questions that someone might have before even leaving the burn unit. Next, we've got James Bosch. As a burn survivor, a therapist, a longtime volunteer for AARBF. He's worked with hundreds of burn survivors over his many years in the burn community. And he'll be touching upon something that's an expertise on his end, emotional healing, grief, and loss. And I think that that's really important, a topic that burn survivors really go through and might not even experience immediately after a burn, and it might take years to process. But James, let's turn it over to you.
Great, thank you, Jennifer. It's great to be here. It's funny you say over the years. So it's like I just start saying like I've worked in burns for a while now, because it's been a while. I started working with the Lisa Ann Rouge Burn Foundation in 1996. So that was kind of my entry. And before that, I was a volunteer at Champ Camp as a counselor. And of course, I am a burn survivor. I was burned as an infant. So I've been, involved in burns in some way all my life. But I'd love to talk about the emotional healing part. And I see Dennis's question, and I actually will talk about that in this next section. Well, thanks. It's a great question, Dennis. Emotional healing, burns are unique because it's not just a trauma to the body, it's a trauma to the mind, the spirit, and it affects every single aspect of a person's life. It's usually, it's just like a disruption of everything that you think you are. So if you're a child and you're burned, you have to develop through your normal developmental stages with this trauma, looking different, having scars, going into the hospital, throughout the years, if you have to have future surgeries as a child. And if you're burned as an adult, your life is turned upside down, and all of a sudden you often have a new image because of scarring and disfigurement, and you have to recreate an image of who you are in the world. And the main thing that's eroded is a sense of safety in the world. Your sense of safety is removed. So you have to rebuild a sense of safety, and then you have to come to terms with some of the losses that you experience when you have a burn injury. So this could be anything from loss of who I thought my image was. It could be a loss of a job. It could be a loss of a house. It could be a loss of a loved one. It could be loss of income. It could be loss of a pet, whatever. There's multiple types of losses that people are struggling with. And so it's really early on, the emotional healing is at first in the hospital, it's all focused on, getting the body back together, closing the wounds, getting the wound care down, surviving. And then when you go home is when all this stuff you're confronted with all this emotional pain and healing. So that's a really a big part of this, the What Now is, dealing with the isolation, the fear, the confusion, the questions about myself and who I am in the world now. And also just like in families. So oftentimes, an adult who is burned badly can't go home, live on their own, or they go home to their wife or partner, and that all of a sudden role reversals and they have to be taken care of. A lot of adults go home and live with their adult parents. That's a whole adjustment for everybody. So there's a lot of emotional healing that has to happen when you come in. So the keys to the trauma recovery is first establishing a sense of safety in the world, then coming to term with the grief and loss of the changes that you've experienced in your life and the things that you don't have anymore, or maybe the things that have been shifted. And then the next part is like trying to make some meaning of your new life, and then who am I now, and how do I find hope, and how do I go forward with this burn injury? And so, you know, people will experience many types of trauma symptoms and when they go home, and some may experience none. But some of the common ones are fear of something bad happening again, you know, hypervigilance, that something bad is, you know, another shoe's always going to drop. So you have this sense of fear, like what's going to happen now if I go do this or if I do that. You also have nightmares, flashbacks, and reliving the trauma, or maybe not the trauma, but the trauma of burn treatment. So burn treatment can be quite traumatizing with dressing changes and multiple surgeries and, you know, different things that have to happen in order to help you heal in the hospital can cause secondary trauma as well. So you can have flashbacks and fear. And then there could be also a sense of wanting to avoid and not talk or think about anything related to the burn. And so there's a shutting down and a denial and an avoidance. So there's many ways that people respond. Another part of the emotional healing is that people often feel that there's a influx of attention and support in the burn center or right when the injury happens. And then slowly that support kind of goes away. People stop coming by as much. People, or I feel afraid to reach out as much. And so there's a sense of isolation. And so, and then there's the fear and isolation that, oh, there's the fear of how I will be accepted with, say, your scars are visual or even hidden. So if you have hidden burns or visual burns, you have pressure garments, you look different at first, right? So there's this fear of how am I going to be accepted? So there's a wanting to hide out and not connect. So a lot of the things that we talk about in the What Now is like things that you can do to not isolate, ways that you can connect either with community, emotional support, professional counseling and help, or just the burn community through burn support groups, burn programs, peer support. Peer support is, to me, like the #1 medicine for emotional healing. You know, it's oftentimes as, you know, there's a lot of guilt and shame and embarrassment associated with the injury as well. Thank you. That's a great point, Pam. So you're not going to reach out because you have this guilt. Maybe it's because how the accident happened or for whatever reason. So, or there's shame about your experience. I wanted to talk about the question that Dennis asked is, how does a person keep from feeling like a failure when maybe needing to call back to the hospital? And that was related to Jill's question. And I think it's also relating to what I'm talking about. Oftentimes there's a fear to shame. I just had this experience talking with a survivor who was her pain was not being managed. She was completely uncomfortable, but she felt like a person in her life that always just dealt with things, and she wasn't going to call the burn center and show her weakness. She didn't want to seem weak or seem like she needed extra help. And so, so it's just like what Jill said, like those calls are people, the burn center expects those calls. They know what some things that might happen and they want you to connect. You know, this idea that I need to figure it out on my own. I mean, that's something that can really cause more problems with emotional healing. And we really encourage you to take risks with reaching out to other people and to accepting support and asking for help. Pain management is a huge part of this going home too, and part of the grief and loss, because my experience is that hospitals often don't do a great job of telling you what you should do with this 500 pill bottle of pills. Like, when do you taper down? When do you stop? And so a lot of people, often the pain is starting to subside, but they notice that the pills work for their emotional pain too. And so they keep medicating with either their prescription pills or even drugs or alcohol that they get on their own. So there are like not great ways to cope with the pain and emotional stress that's happening too, that we want to help you with and get you the support to too. And we talk about that in the booklet as well.
Great, thank you, James. Jill and James covered a lot about, you know, maybe the physical recovery, the emotional recovery. So it's a lot of internal work that survivors have to do. And when they're ready, the next step could possibly be moving forward, stepping out. And that could be really challenging because it's not just doing internal work anymore. It's also interfacing with the external world. So we've got Sadie Wilcox, who will be talking a little bit more about that portion of the What Now brochure, about stepping out and moving forward.
Yeah, thanks, Jennifer. Hi, everybody. It's so great to see so many different familiar faces and so many different generations that are represented here as well. And so I recognize many of you, and a shout out to everyone who tunes on after the live segment in weeks or months or even years ahead and tunes on too. So stepping out, it's such an interesting topic, and it really, I think, relates to so many of the themes that James has already brought up and Jill has brought up. But to piggyback on this idea of preparing yourself in the hospital for discharge and then transitioning into returning home or returning to a living environment outside of the hospital setting, and then beginning to think about and anticipate the challenges of reintegrating back into society in this with this new physical, emotional, spiritual, psychological trauma that in most cases is still hugely relevant, and sometimes even more relevant because you don't necessarily have the support structures in place at that early stage of reintegration. For many survivors, many of us hadn't connected with other peers or other burn organizations or other survivors who understood the experience once we left the hospital. So sometimes there can be a real gap in services and support during that time. So it can be all the more overwhelming to figure out how to reintegrate in a healthy and supported way. As I was looking over the What Now booklet and reminding myself of some of the content and the prompts that we added in to the current edition, it really resonated with me that the stepping out is not only that first time you're entering back into the public. It is that first time. There's a lot of anticipation that happens and fear and, anticipatory anxiety about that first reentry moment. But it's really, in my experience, it's really an ongoing process, and it's a continued process of the many stages of stepping out and the many stages of refamiliarizing yourself and reintegrating into a new life as a burn survivor, and figuring out, what that path looks like for you and how that path might evolve over time. So looking back, I was burned in my early 20s. I was a 24-year-old. I was a young adult. I was kind of in that in-between phase of childhood, young adulthood, and that's kind of a window that a lot of that kind of falls in between the childhood burn trauma and the adult experience. So many of my peers were getting their first jobs or their first apartments or moving on to their milestones in their lives. And I was moving back in with my parents at the time. And I think for me, I was burned in an incident of abuse as well. So the trauma story itself was very traumatizing to tell, both for myself, but also for the recipient, the receiver, the person hearing the story for the first time, especially if they know me or knew me at that time. And so gauging how much to get into the survivor story and the trauma and how much to hold back was really tricky at the beginning. If, someone in my community had learned that I was burned but didn't necessarily know the whole story, it's always kind of a challenging decision on the spot to decide how much you get into it or how much you don't. And you don't want to, in my case, I didn't want to further traumatize people. They're already, it can be overwhelming to hear about the extent of a large scale burn injury and the physicality of that. People have different levels of comfort with learning about the extent to which the burn injury can really devastate your physical body. And then the emotional, psychological was obviously a really important part of that telling and that sharing. And I think James mentioned this idea of trauma symptoms that are really common and normal in the burn recovery process. And when you're stepping out into society and into your community and reintegrating, the trauma symptoms are often emerging in real time. And so you may not even be familiar with them as you're sharing your experience in the hospital or your experience with recovery from burns or your burn story, the trauma symptoms can actually be activated during that telling. So one of the topics that I think many of you burn survivors on the call are probably familiar with is having versions of your story to claim the narrative in the moment and rehearse those versions of your story, so that if you're in a public space where you're not necessarily wanting to get into the all of the story at that moment, you can tell a version of the story that you feel most appropriate and most comfortable with in that moment. And then if you're in an environment where you feel like this is a safe and supportive environment and a therapeutic environment to really get into more depth with your story and share in an authentic way with someone who is really eager to hold that space for you, then you have an opportunity to go deeper. And I think in the early stages of stepping out, a lot of burn survivors are not, I know myself included, are not necessarily familiar with trauma symptoms that might emerge during that sharing process. So it can be really destabilizing when your physiological body reacts to trauma symptoms, and you may share a portion of your story or a version of your story, and then your body is reacting and is hypervigilant or is experiencing post-traumatic stress symptoms. And how do you re-regulate and integrate and metabolize some of that physiological reaction? So having different versions of your story allows you to practice and allows you to familiarize yourself with your bodily responses, your physiological responses, and it enables you to kind of control and shape the narrative and reroute when you need to, so you can check in with your own ability to regulate. That said, I'll also say from personal experience that sometimes it just, it's just a mess. And it's going to be messy, and it may not go the way you planned or the way you anticipated. And that is, I think, a natural and valuable part of that recovery process, is to know that it's not always in your control, and that the layers of the onion, I like this analogy of the burn recovery process can be like layers of onion. You can get through one phase of it, and that opens a whole new phase of healing that you weren't expecting, or you hadn't anticipated, or didn't know how deep it really goes. So each time you're stepping out, that the layers of the onion can continue to unfold, and that can be a lifelong process. And over time, in my experience, it has been a really rewarding and enriching and powerful process, and has offered a way to connect with other people in really deep and profound ways. But in the early weeks, months, and years of that process, it was really challenging, and having the support and seeking out support, I think, is absolutely vital and really, really useful in that whole process.
I want to add on that, Sadie, too. Some of the trauma responses are mood related, like you said. So depression is normal, anxiety is normal. And so sometimes stepping out and pushing through those moods is hard too. And there's also a lot of terror for some people, how they will be received. So stepping out with allies, I think, is really important. Surrounding yourself with safe people that can do it with you and be your team in those early stepping outs is really important.
Thank you, Sadie. You brought up some really great points about sharing your story and how intimate that could be, as well as how burn recovery can be seen like an onion and all these layers, right? We talked about physical recovery, emotional recovery, now the social recovery, but something that some survivors may not even be thinking about initially after a burn, or possibly could be, depending on what their life was before a burn, is sexuality and intimacy. That burn is has physically, emotionally, socially affected this person. How is it going to affect their sexuality with a partner or a potential partner? How is that going to affect their intimacy with a current partner or future partner? So we've got a resident expert on sexuality and intimacy, Ms. Cindy Rutter, to speak on that topic.
Thanks, Jennifer. It's great to see everybody that's here and to see the people that are participating, but also colleagues that I know this is a topic that can be difficult to talk about and to bring up. And so it's kind of, in recent years, it seems like it's becoming more of a topic that healthcare providers are willing to bring up. And because I think a lot of times the patient thinks if it's important that the nurse or the doctor or the therapist will bring it up, and you flip that over to the healthcare providers and they actually think if the patient wants to know about it, they'll bring it up. It's uncomfortable. So a lot of people don't want to talk about it and don't want to discuss it, but it is so imperative. And I think for me, even I've been in the burn community for many years, as James says, many, because it's so many, I don't like to give the number anymore. But, and also being a burn survivor, it came to my attention, and I have been working in burns for many years, but sexuality and intimacy actually really came to the forefront for me when my dad had a heart attack. And I was sitting in the room with him and my stepmom, and the nurse came in and started talking to them about what they could or couldn't do sexually after his heart attack. And I thought, wow, we're way behind the 8 ball in burns because we're not doing that. So that kind of catapulted me into thinking we really need to do it and talk about it. So I feel like I've been talking about it for a while, and it can be an extremely uncomfortable topic, and it's vast and varied. When you think about, you know, is somebody in a relationship? What is it going to be like when they go home? What if they're not in a relationship? How old are they when they were burned? Are they a child that they're now going to grow up with this? Are they a teenager or a young adult like Sadie was? It changes a lot of factors in your life. If you're in a relationship, I think one of the things that we have to remember is not only is the survivor impacted, but their partner is impacted. And there can be lots of questions around that, as far as the partner may think that if I touch my loved one that's endured the physical injury, I may hurt them. And so talking about it and communicating, I think, is key for the survivor and their significant other. So, you know, and reaching out and asking questions, but it can be, again, very uncomfortable. So when we talk about discharge and going home, and if it hasn't been brought up prior to discharge, when is the appropriate time? And a lot of people say, well, maybe it's in clinic when they come back to clinic. Is there really an appropriate time? I don't know for sure. I don't necessarily have the answer. And the other question that comes up a lot with survivors is, who do I ask? Do I ask my, you know, nurse, my doctor, my occupational therapist, my physical therapist? Who can I address it to? And I think it's important to recognize that the question can be addressed to anyone, because then we'll find who you need to actually talk to if the person you ask isn't comfortable. I think it's important to recognize that the burn survivor has gone through a lot of physical changes, and things that may have been comfortable before are no longer comfortable. And so talking about, you know, what is comfortable for you, and also recognizing that mobility may be an issue. We talked about pain. Pain can still be an issue long after the wounds have healed, and recognizing that, so that, you know, again, I think communication is key in sexuality and intimacy, and making sure that you do that. And if in fact you're feeling like that discussion needs to be taken to a professional level, there are therapists that are sex certified therapists that can talk to you about the issues. And reaching out for that help doesn't mean you failed. It actually means you've succeeded, because you want to go on with a life that includes sexuality and intimacy. I think there's always that fear of rejection as far as being a burn survivor, whether you're in a relationship or going to start a new relationship. So I think that that's something that we certainly need to recognize and think about in regards to sexuality and intimacy. I'm a firm believer that sexuality and intimacy is a huge part of our lives as human beings, and it has to be incorporated into your recovery and reintegration to life. So I don't think it's something we can put on the back burner and just let go by the wayside. This is a topic that we could talk about for hours on end. So to try to put it in 5 minutes is tough, but I think just recognizing that it is something that should be talked about. And you as a survivor or as a family member, definitely bring it up, talk about it. It can't be a taboo topic. It needs to be out in the open. So with that, I'll stop because I could go for hours.
Thank you so much, Cindy. As you can tell from all the speakers, a burn injury causes so many complications and so many, touches so many areas of someone's life. And as an adult, hopefully, you can reason and ration through it or work through this and understand, that all of these different aspects of your life have been affected by your burn injury and you need to work on these things. But when you're burned as a child, there's greater complications around that, right? There's developmental stages that children go through even without a burn injury. And so layering a burn injury on top of that can make recovery even that much more complicated and that much more challenging. So we'll go back to Sadie, who will be able to speak to us a little bit about children and their recovery through burns.
Thanks, Jennifer. Well, I have a couple touch points I'll just mention based on the What Now booklet, but I think this topic is really most appropriate for those survivors who were burned as children who might want to chime in. So I'll just get us started with a couple prompts from the booklet and then open it up if folks have thoughts based on their lived experience. So we added this section to the 3rd edition of the booklet because we thought it would be really helpful to get more support for caregivers, parents and caregivers as they're navigating the experience of children who are recovering from burn injuries. And first and foremost is supporting the caregiver so that trickle-down effect to children is felt, that the caregiver is supported by the team and by the wider burn community, and that therefore can better support the child in their recovery. We included topics of regression, normal regression for even through young children as well as teenagers have normal regression in response to burn injuries. We addressed the topic of peer acceptance, body image, rebellion and curiosity are a thing that are very common in the recovery process. And then we added a component in collaboration with a number of child life specialists focused on the play as language of children. So there's lots of ways that play as a modality can support kids in their understanding of their own recovery process, of the injury that's incurred, and can help adults, trusted adults in their life, start to understand, well, how is this child interpreting what's happening to them? And one common experience when seeing children, traumatized children play is that they might use repetition and repeat over and over again some components of the burn injury or the hospital experience or the elements that they may seem to be fixated on, but in fact the repetition within the context of safe and supported play can be a way of processing that trauma in a healthy way and gaining mastery over the trauma and coping with the trauma. So those are some of the elements in the book, but James, I don't know if you want to.
The only thing I want to add, which is I think so important, and this is from my own experience of being a child burn survivor and working with so many children burn survivors over the years, is helping parents talk about the burns in an open and acceptable way in front of the children, so it doesn't become a taboo topic and children don't internalize this shameful, I have this thing that people won't talk to me directly about. And helping families have a vocabulary, a healing vocabulary to talk about the burns, talk about what's happening in school, talk about what's happening in public, talk about being able to mirror the child's experience and their feelings about what they're experiencing as a burn survivor makes all the difference in the world in child development when you're talking about burns.
Great, thank you, Sadie and James. Speaking with quite a few child burn survivors, you know, that there's a lot of trauma that goes around along with the burn injury. There's the physical recovery. A lot of child burn survivors build a great rapport with their hospital staff and feel that they're really helping them through their recovery. They go home, it's their family who's supporting them and providing their care, so that they build a new sense of normalcy. And then there's returning back to school. So that adds a whole new element of a trauma or fear or pain. So that's a really touchy subject. As adults might return back to work or out into society, children return back to school. And Pam Peterson will talk a little bit about that journey of a child going back to school after a burn injury.
So thank you, Jennifer. And I appreciate having this opportunity. So I think what's really interesting is I've been listening here too, and I would encourage folks with who have went back to school with a burn injury to chime in with questions and such, is the fact that it's not just for the child going back to school, it's for the school, and it's also for the parent. And having a supportive parent behind it, or getting the parent as involved with it as the child, is really, really important for a successful reentry. So, and that the book kind of talks about that, but really going back to school creates a lot of anxiety and worry. And I think the point here is for not only for children, but for parents as well. So when you're doing a reentry program, you should really consider plans to address the child's physical and ongoing health needs. A lot of times schools and any community reentry is worried about that. Their emotional needs after the trauma, their attention span and learning needs, some of their social considerations, such as like scars and how they've altered their appearance, their need for support. There's lots of activity modifications, and so on and so on and so on. So, I mean, I think we can go on for a while on just activity modifications and needing water and needing more frequent bathroom breaks or those types of things. We also know that getting back to living is healthy, and a well-coordinated school reentry program really facilitates that positive reentry into peer groups and daily activities at school. I think Sadie said earlier too that there are many phases of your story and getting comfortable with your story. And I think a school reentry, when you're able to tell that and tell that over and over again and rehearse and practice, and then go in and do a school reentry with your, favorite nurse or your favorite teacher or your parent, it really helps you to kind of tell your story and grow and work through that trauma as well. So kids benefit from that too, not just adults. So some of the benefits and the impact and the importance of school reentry, I think it's really reestablishing their lives. It's really getting kids back into their norm, or whatever their new norm is. I hear new norm a lot, but just getting them back reestablished with their lives, with their community, with their peers. And there is I do hear a lot from survivors and parents that, well, he or she can't go back to school, so we're going to homeschool them. And it's always really encouraging to get them to work with that parent and get that parent to get that child back into whatever peer and school activities that they were doing prior to the injury. So it's also part of the recovery process from a burn injury. It's also what's really, really important about a reentry program, and the book speaks about this, is to really having a formalized a formalized plan for the academic, the physical, the social, and the emotional recovery needs. So the goals of these programs are really to educate the students and the teacher about burns, but what the child and the parent learn going through this is priceless as well. You know, they learn how to tell their story, they learned different versions of their story, and they learn when they're emotionally ready to tell their stories and when they're not, what they can do. So, so it's really that supportive environment where the burn injured child can learn and thrive. So I pulled a testimonial, not being a survivor myself, and I know that there's lots of survivors on here, and we've got lots of survivors as speakers. I pulled a testimonial that really spoke to a school reentry experience that we've experienced. So I'm going to read that to you. Ethan's school nurse used this resource to help the other students understand Ethan's burns and his recovery. Ethan and mom Sarah enjoyed making up crazy scenarios for role-playing exercises, often laughing together hysterically late into the night as they practiced answering questions about his burn. When Ethan returned to the classroom, he was never mocked or taunted. Sarah and Ethan have a new life in which they experience looks and comments daily when they're outside of their home. However, the family doesn't dance around Ethan's injuries. Later, after experiencing a harsh comment during a sports match, Ethan was able to shrug it off and keep going. Mom, he said, I think I look fine, so who cares if he doesn't? Sarah continues to learn from Ethan and his resilience. He's teaching me to be a better person. So that just really speaks to the importance of involving the parent as well as the child in a reentry. So there's some elements of a successful reentry that's described in the What Now book. One is communication and planning with the school personnel. That includes classroom teachers. It could include the school nurse, the principal, a counselor. The bus driver is an important piece to this as well. Lots happens on the bus before you actually get to school. So the bus driver, looping them in is an important piece of this too. Another important piece of this is having input from the child. So the choice and the control for them is so important. The when, the where, and giving them as many choices and as much control over this reentry as you can. They can choose the reentry steps. They can choose what they feel is really beneficial and really will assist them in the transition. And maybe even going out into public and doing practicing a little bit in public even before you do the school reentry is it's a great resource for kids. So make plans for addressing their peers to decrease staring and questions by providing information up front and making peers the child's allies on their team. So oftentimes with school reentry, you get their friends involved and they're helping them kind of come back to school and helping them to, with their getting from class to class, or helping them also with their physical needs as well. And then I think we've talked about this a lot, but making plans to deal with those physical needs. To keep the kids' attention at school, there's itching, there's that attention span, there's pain medicine, staying out of the sun. What am I going to do in physical education, gym class? So really making plans to deal with every aspect of what the kid's going through. So I'm going to end with a testimonial. This is right out of the What Now book on page 22, if you want to look it up. From Jessica, she said, I was really scared about going back to school. I had pressure garments and a chin strap. The nurse and the firefighter went to my class and talked to them. When I returned to school, everyone was so great. So that's an interesting quote, that the child was maybe not involved physically in the school reentry, at least from reading from the quote, she may have been, but she was not physically involved maybe with the school reentry, but a firefighter and a nurse went in and they, helped the children to understand what Jessica was going to be going through when she was coming back. So it's an also interesting take. Jessica gets to choose her reentry. So I'll scoot that back to the moderator.
Thank you so much, Pam, for going over some of the intricacies around going back to school. As simple as that sounds, right? I like the child's physically able to go back to school. Awesome, let's get them back in. But there's so much groundwork that needs to be done before bringing them back in. And thank you for going over those considerations. So the webinar is called Meet the Authors. We are so grateful for our wonderful panel of speakers who all contributed to the book, but this is really an opportunity for you to ask questions, to dig deeper into any of the sections from the What Now book. And then we also have some additional resources to share with you as well. But I can see we've got some burn care facility supporters here. We've got burn survivors of all ages. We've got board members. We've got people from all over, from all different walks of life in terms of the burn community. So we would love to answer any questions. Our speakers are here to lend their expertise and any questions that you might have for them. Daniel, I think we've got some questions in the chat, and then if anyone would also like to unmute and ask a question as well, we can do that too. But let's start with some of the questions from the chat, Daniel.
Well, I can answer one that I can read here from Brookie Kappa. The question is, as a care provider, how do you approach with families how to have these discussions with their children? A lot of them feel like there is a lot of fear with the parents having to hold that space for themselves and their child. And I think for me, it's, as a burn care provider, is modeling that how to talk about the burns in an open and supportive way. And I do know that families often get this idea that if we talk about it, it'll be a problem. That's a myth. If you don't talk about it, it's still a problem. And also, I don't want to hurt my child more by talking about these things, but actually, it does hurt more to not talk about them. So modeling these type of how to talk and creating space and doing that kind of education with the parents of why it's important and why it's good and how you may feel fearful, but this is actually helpful. So I think that is how I would approach that question.
Great. Some other questions we had a comment from Dennis Gardin, who was talking about how, and this is for you, Pam, how the re-entry programs in back to schools can also be traumatizing for them going back to school. So any quick tips that you would maybe suggest to make sure that we don't traumatize them and traumatize the family or the burn survivor?
Yes, I think that's a really good point, Dennis, and I'm glad that you kind of brought that up. I think the important piece to that is letting the child lead, giving the child the control and letting the child lead and not forcing anything on them because it's the right thing to do or it's the best thing that we think they should do. So as you're doing school reentries, and if you're even using, a school reentry resource, it's important to let the child take the lead. And I gave like 2 testimonials, one where Ethan was all in. He went to the school and he was all in. And then the other testimonial, I could only kind of demise from that Jessica was, I would prefer not to be all in with the first time and then go back in slowly. And again, that just shows the ability to let the kid lead, let the child lead.
Great. It looks like, Dennis, you may have a follow-up to that, so we'll mute you.
Oh, okay. Yeah, it's good to keep me muted as well. I do have I wanted to say something about that, but real quick, I know, James, you said pain kills sex drive, and that depends on what you're into. And Cindy said 5 minutes wasn't enough. As you get older, 5 minutes is plenty of time. But
Where's the mute button?
Yeah, exactly. But like school reentry, social reentry, based on my experience and kind of what I've seen, but I want to reflect on my experience. It was in some ways more traumatic for the community, for my church, for school. To give an example, when I was discharged out of the hospital, still fully bandaged from head to toe, there was a surprise welcome home party for me. And it was classmates, it was the community, it was my church pastor. And there were probably 3 or 4 dozen people at my house for a surprise welcome home party. And of that 3 or 4 dozen people, only outside of my family, only about 4 of them had ever seen me. So here I am coming home, fully bandaged, looking like a mummy, and no one was prepared for it. You know, and it was very, I can look back on it and see, it was very traumatizing for those people, because they thought, they remember me with my gym shoes on and my baseball hat. And it was they wanted to do the right thing, but it was so clumsily handled. And I also see that with school reentry, going back to work, talking about intimacy and sexuality. It's just, some of those are hard topics anyway. And I guess we expect it to be a little bit different because now I'm burned. Because I know in school, before I got burned, I was teased because I had a large head, you know, and nobody, and then it was a non-issue. But now when I'm teased because I'm burned, the troops rallied around me to protect me. So it was just an interesting comparison because it hurt just as much when they teased me about the size of my head. But the burn, I kind of had an excuse attached to that. So actually the other thing was more painful, but that was okay somehow, you know? So it's just very interesting when we talk about feelings and emotions and how we prepare. And I love the fact, Pam, that you said, let the child lead. Because as caregivers, we all can find ourselves in a place where we're taking care of somebody or doing what we think someone needs without even asking them where they are, you know, in that journey. So I just appreciate all you guys, your efforts and what you're doing, and even coming on and doing this session, because I didn't know about the book, and I should feel embarrassed saying that. I wasn't aware of the book, but I am putting it in order to get some so that we can distribute it to our folks, so believe me.
Thank you, Dennis, for those words.
I'll mute myself again.
All right, thanks, Dennis, for those words. You know, Dennis, you brought up something, and this will be our last question, and then we'll talk about some resources that we have as we're at the 4 o'clock mark. But Boba or Yafet had mentioned about surgeries, and that in the book, we talked about surgeries and how, as a burn survivor, the fear of even being able to see one's scars. So I wondered if any of the panelists can talk about dealing with fear. And I think fear is a common thing that we can all relate to. And I think there's some great sections in that. So maybe James or anyone else who would like to talk about the fear component.
Sure. I mean, everyone on this panel in this audience that I can see in the participant list could talk about this, but I think your question, Boba, is really, really powerful because early on, there's a lot of fear. I even find from hospital staff about when do we expose or let them see their scars or talk about the scars. And in my experience, and shake your head, yes or no, you've already saw or thought about or were thinking only about looking at your scars from day one when you realized you had them, correct? So this topic is in the survivor's mind right away. So again, and they are seeing themselves in the reflection on the paper towel holder when they're being walked to therapy. They are seeing themselves in all kinds of shiny reflections, or if not mirrors themselves. So this is like something that I think we need to prepare and talk about early. This has always been a thing for me, like a shingle that I've always like, we got to talk about this early, and how you approach it is very individual to the survivor too. You need to know, what they need and build a team plan around this. But going home after a surgery and then taking off your bandages and then taking a shower and looking at yourself for the first time, it can be a scary moment. And because your scars then are looking often angry and very raised, and they're not how they're going to look in the end. And that's another important thing that we need to talk about, that scars mature. So I think that is a good point, and I think that we do talk about in that book, but that's something that we can all do better, right? So thank you for that question.
I just wanted to thank you guys, ever since Champ Camp ended, I definitely felt more comfortable speaking about my scars, and I came to realize I shouldn't be embarrassed with them or anything of going out, and I think like social media, like speaking up and stepping up and like, you know, getting the story out there is important. And I realized like it can help other people as well, you know. And like I just wanted to thank you guys for that.
Thank you for sharing your story and your confidence with us, and the power of peer support, right? Because being around other survivors really helps, doesn't it?
Right. No one else like understands.
Thank you. Awesome.
Great, and that's a nice segue into resources. And the book is a resource itself, but we wanted to share some other resources that are in the book and then resources for burn survivors and their families. So we're actually gonna let Pam, if you wanna just share some resources on a national or actually international level with the Phoenix Society for Burn Survivors, and then I will finish up on some resources for the Elisa Ann Rusch Burn Foundation.
Sure, thanks, Daniel. So I'm gonna just try to send you guys to some links actually, because it would just take too long to go through all of the resources that we have. Can you guys hear me okay? My Zoom just popped up to join audio.
We can hear you.
So, okay, thank you. So there are kind of resources for all members of the burn community, and I just really want to stress that, not only for survivors, but also for the survivor family. They are survivors as well, and the burn, and really the burn community. So loved ones, friends, neighbors, all professionals as well. So some engagement opportunities that you can really get engaged with support groups or youth and family online groups. There's chat that happens. There's drop-in opportunities. You can find all of these on our website. It's phoenix-society.org/connect. Save yourself some time and get that /connect in there. It'll take you right to the page. Something new on that page is our calendar. So we now have a calendar that not only has the Phoenix Society offerings on it, but it's also a place where you can submit your local offerings as well. So one place to look and see what's going on in the entire burn community. So if you have an offering, you want to click, or you want to share with us too, a support group or something like that, please click on that and hit the submit button on the calendar page, and it will be on there as well. And then the resource library, I can't, really stress enough about the resource library. It's something that's there for you day or night. Full of videos and trainings and ebooks and survivor stories online. So check out the resource library, and again, you can find all of that at the Phoenix Society website /connect.
I might put it in the chat so they can copy it out of the chat too.
Okay, if you're interested in the Journey Back resource that's related to going back to school, as a clinician or even as a, as a parent or as a survivor. That one is not online yet, but you can certainly get that by just either emailing info@phoenix-society.org or myself. You can find me on the website and email me as well, and I'd be happy to send it. So.
Great, thanks so much, Pam, for sharing with us. I wanted to just go over some information with you guys. As Sadie mentioned in the beginning of the call, the What Now book is now in the 3rd version with our original artwork that actually James's aunt helped create. There it is right there. James is showing you in his little window view. We were really excited about releasing this and having this come out. So we had some really great questions also within it that Lisa Powell had asked, and Lisa was actually, as James mentioned before, a huge part of the What Now book in the first edition of it. But the question was how many people get the book, or how distributed is the book. We probably estimate about a couple hundreds of books are sent out throughout California. The Elisa Ann Rusch Burn Foundation is a California-based organization. So we partner a lot with our local burn units and with survivors who come through the foundation, and in providing them with this resource. One of the big push as we looked at the 3rd version of this book was actually creating and expanding on the resource list, and then including a hospital discharge form. So one of the new changes that we have is anyone who's a medical provider out there and who's interested, there's a way in which you can provide this book to your hospital and to people who are getting discharged, where they are able to sign off and release their information to the Burn Foundation so that we can follow up with them. And this is huge when we talk about being able to connect with burn survivors 1 year, 2 year, 5 years, 20 years out of their hospitalization. So that was a new addition to this latest version. But we also wanted to look at other things. So in the back of the book, you'll see from suicide to addiction to even PG&E and how to get connected to local resources and getting maybe subsidies or some reduction. So we really encourage people to look at that back of that resource section. And then just some additional offerings about the Burn Foundation, similar to the Phoenix Society. We do a lot of online support groups, especially currently right now during the state of time that we are in which you can log on at any time and join a group. We also encourage people, like James mentioned, peer support is a huge lifeline out there, and we can connect you with another burn survivor or a family member, and you can have a conversation with them at your own time individually if a support group is not right for you or you're not into online virtual spacing. Eventually, we hope to get back into our in-person groups. In addition to that, we have a lot of other programs out there. We specialize in recreational programming, from our Champ Camp, which Boba had talked about a second ago, to our young adult retreats, to our family programming, hoping to really utilize recreation as a source of connecting people to one another. And the last thing I really want to focus on is our therapy grant, in which we're able to get people the support they need with mental health providers. So if you're interested in any of those resources, I will go ahead and put the link for the Burn Foundation in the chat, but we really encourage you to check out some of the programs that we have, check out some of the things we're going through. We really want to thank you for joining today's webinar. If you are interested, the What Now book is available online through our ebook, and we're super excited. We have some great news, and I'm not sure I still see them on today's call, but we recently just translated our What Now, our latest version, in our Spanish version, and that will be available on our website very, very soon. And we are proud to say that we had some support from a student at USC and his father in helping convert our newest version into Chinese. So that version will also be an ebook as well as a hard book. And then we are working on other languages we have in the pipeline right now. So if you are interested in getting books for your local hospital, your foundation, please go ahead and send us an email at the Burn Foundation. Otherwise, please access it free online at the Lisa Ann Roosh Burn Foundation's webpage. Thank you for everyone joining today. Thank you to our amazing panelists for your wisdom and your words. It was a great time today in speaking with you. And until next time, be safe, and we hope to see you soon.